And you basically insert it and you open it as far as you possibly can. You hold it, and I'm supposed to do that as many times as possible. I did attempt to do that on my third, maybe fourth day after surgery, and it was so very painful. I did it maybe 3 times, and when I tried a fourth time, my jaw seemed to almost lock, and it slid over to the left a little bit, and it put me into a panic. And when I tried to take the therabite out, it was very, very slow because I was in so much pain. And as I said, it almost was in a locked position, so my jaw was kind of shaking as I was pulling it out. So I think it was a little too soon to do it, and I haven't attempted since then. And it's partly fear and part pain. So um, I may attempt again before my post-operative appointment. I may not. But I am on pain medication, of course. I'm on 4 milligrams of Dilaudid, and that's every 3 hours. I'm on Robaxin also, and the combination helps, but it definitely doesn't get rid of all the pain. I'm trying to cover everything because people have a lot of questions. And if you have any other questions that I'm not addressing, let me know because I'm trying to, um, get to everything because I had a lot of questions before my surgeries, and there there wasn't anyone out there that answered everything or covered the things that I thought was most important or the things that I was really curious about. So if there's anything that you want to know, um, ask away. I'll try to answer. Um, my weight loss had gone from about 16 pounds to about 25 over the past 6 to 3 months. I mean, counting backwards. And it was noticeable over the past 3 months. Um, and I kept trying to say that, it's just the stress of being nervous about the upcoming surgery, but I was noticing more and more that I just haven't been able to eat regular foods. Currently, I'm on a all liquid diet. I've been trying to put things like mashed potatoes into my diet, but I'm literally just swallowing it. Uh, I am doing like pureed soups. Like I'll take a vegetable soup and then puree it in the blender. I'm doing applesauce and yogurt. Um, the mashed potatoes sometimes will be too thick, so I've added milk to it. Fried SpaghettiOs, but they're high in sodium, so I drink a lot of water. And SpaghettiOs, I'm literally just swallowing them too. I drink Ensure. Um, um, I've noticed, I thought this was odd. I noticed that it almost feels like the joint is loose. I didn't notice this with the last surgery, but also I couldn't open as much, and I can open more than last time. And I can feel it clicking and kind of rattling, especially when I attempt to brush my lower teeth. Uh, and I asked the surgeon about this, and he said the strangest thing that the joint is kind of not loose, but basically once the muscle continues to heal, it will kind of muscle will shrink into place and kind of suck into the socket. The joint will. So, and that will stop the clicking from happening as often. But it is really unnerving because I'm so used to that clicking and knowing that it has to do with a bad joint. So that's something that I'm getting used to. And in going back to brushing my teeth, I couldn't do that for a couple days, and I can't stand that because I'm big on oral hygiene. but I'm using a baby toothbrush, and that's much easier. And um, I'm trying to cover everything. I I've been having a bloody nose, and my throat is very dry, so I use cough drops. But all of that has been due to the breathing tube from surgery, and just kind of a rough um, sore throat feeling. And I had like a lot of mucus buildup right in my throat. It was very irritating. And in the hospital, I had like a little tube hooked up to a suction device, and I would have to kind of use that pretty often. And it was to try to get that mucus and blood up. And it sounds awful, but and that was almost more irritating. But even now, 5 days after surgery, I'm still dealing with coughing up some blood and mucus and with a little bit of a bloody nose. But slowly it is going away. Um, but I just want to bring that up. So if anyone is going through surgery or just coming out of surgery and you're noticing little things like these, um, it's not unheard of. I don't know how common it is, but don't be too scared. It's happening to me. Um, I'm looking over because I did write some notes down so I don't forget some things. Uh, I'd have a lot of teeth pain, especially in the lower part of my jaw, and I had that happening beforehand. And I mentioned it to the doctor right before surgery, and they said it was due to, the joint and just, uh, needing to have this other surgery. And then coming out of surgery, they explained because of the bad shape that joint was in, that probably all was going hand in hand. And like I said, the surgeons saying that they'd never seen anything like that, that probably was a big contributing factor of that. Um, let's see. I'm sorry for the delayed um, and all the ums. I think that's about it. But I am doing a lot better than I did after the last surgery. If you saw any of my other videos, I talked a lot about the emotional stress and just what I was going through mentally and emotionally. That was very, very difficult. It was a lot to get through because even if you have someone there with you, you kind of feel alone. You know, you feel like you're just bothering somebody to talk about it, or you don't want to bring up again, just whether you're just going through the TMJ issues, or you're going through about to have surgery, or you've just had surgery, or you're where you are, or where you are, where I am now. You don't want to have to keep saying, oh, it just hurts, oh, it just hurts. You just feel alone. But if you are in any of those stages with this, like I said in previous videos, it gets better. And it got better for me. Um, I'm in better spirits this time. And I think because I did come out on the other side, things did get better. And sometimes physically it might not for some people. And it took quite a while for the effects of the Bell's palsy to go away. And that was so hard to look at yourself and you don't see you. And it's not from a vanity standpoint, it's just, you don't know when things are going to be normal again. But it did go back to normal for me. But, here I am again after another surgery. I didn't think I'd have to have another surgery, to have to go through all of this again. And I'm looking at myself again, and I have the paralysis again, and I wonder every day, is it going to go back to normal? And I do wonder, am I going to have pain again after this surgery like I did with the last one? And I wonder, what are they going to do if I'm going to have pain forever? And what am I going to do if the paralysis doesn't go away? But I am in a better place mentally about it all, and I'm taking one day at a time. So, things will get better. And I'll be around if you have any other questions, and I will update a lot sooner than this last time. I won't let it be another year. If you have any other questions, please message me, and I will be back again after my post-operative appointment to let you know how things are going, and I'll update during my Therabite progression and let you know how the therapy is going.